Every week here on 12 News this morning, we're joined by the Target 12 investigators as we go in depth on some of the latest news. Steph Machado is with us this morning. She's going to be breaking down the state of the pandemic here in Rhode Island as we're going to see those new restrictions for masks and vaccines that will be taking effect on Monday. All right, so Steph, we're now back up to more than 1,000 positive cases a day. Let's talk about where we are now compared to the height of the pandemic last year.
Yeah, so the best way to look at this is in this chart on our COVID tracking page on WPRI.com. My Target 12 colleague Eli Sherman updates this every single day. The blue line you see here is 2020. The yellow line is 2021. And you can really see how the current case numbers on a 7-day average on the right side of your screen are almost exactly where they were a year ago. And remember, a year ago, many of us were staying home. We weren't going to work. We weren't gathering. There was a slightly less contagious variant going around. This year, we have vaccines. Life has returned to some sort of normalcy, but we have a more contagious variant in Delta that's been dominating Rhode Island for months, and Omicron is here and expected to become the dominant strain soon. So the rising case numbers are concerning.
All right, so we know vaccines can prevent severe disease in those who are infected with the virus. Are the COVID cases we're seeing now less severe in Rhode Island this December compared to last?
That's a really important question. And listen, are the infections as serious as they were pre-vaccine? Is something we're trying to figure out. Here's the comparison of 2020 versus 2021 for hospitalizations on a 7-day average. It's a different story here from that positive cases chart I just showed you. The yellow line for 2021 is much lower than the blue line. So fewer people are in the hospital right now. Of course, hospitalizations are a lagging indicator. That yellow line is rising sharply, as you can see on the right side of your screen. So we'll be keeping a close eye to see where it goes. All
right, so Target 12 also reported earlier in the week that most of the people who are hospitalized with COVID are unvaccinated. Some people, though, who are vaccinated are ending up in the hospital. So one of the questions we keep hearing is, do we know if these people have been boosted?
Right. So as you said, about 2/3 of the hospitalized patients are not vaccinated, according to data from the Department of Health. And health leaders point out there aren't all that many Rhode Island adults that aren't vaccinated. So that's a pretty high proportion. But it's true that breakthrough infections in vaccinated people are leading some of them to end up in the hospital. We don't have hard numbers on how many of those people have been boosted, however. But a lifespan doctor told our colleague Alexandra Leslie that very few patients in the hospital are boosted. So health leaders are really urging people to get a booster shot to get added immunity as time passes since we got our original shots. Dr. Nicole Alexander Scott, the director of the health department, said the definition of fully vaccinated will soon include those booster shots. Here was her strong message on Wednesday.
You need that extra dose of vaccine to get the best protection, particularly for Omicron. It's true today, and it will be that much truer in several weeks when we have more Omicron circulating in Rhode Island and likely predominant in Rhode Island shortly.
And as of this week, 260,000 Rhode Islanders had been boosted. That's less than 30% of the population, so we've got a ways to go to getting more people those additional shots, especially if the goal is to do it before Omicron really takes hold.
All right, Steph, thank you so much. And you can see much more of our COVID data on our Tracking COVID page on our website. We also have all the details of those new restrictions for indoor mask wearing and vaccine requirements that go into effect on Monday.